Mr. Speaker, it was obvious in the Premier's answers to my questions yesterday that he's not up to date on what's happening in the emergency medical system in Manitoba.
That's clear.
I asked about the basic air ambulance service, a fixed-wing system which involves numerous companies licensed to provide this service, including Perimeter Aviation, Keewatin Air, Sky North Air, Mississippi Airways, Fast Air, and Sky Medical. In order to ensure a more accountable, standardized, quality service, the EMS report recommended immediate action to include a request for proposals to be issued for the delivery of basic air ambulance services. It's now been more than 2 years. Why has there yet been no request for proposals put out?
Mr. Speaker, the EMS review was a very important process that we went through to improve emergency services in Manitoba, and the member will recall yesterday that many of those recommendations have already been implemented. We have advanced paramedic training in place now, Mr. Speaker. We're moving forward on that. We've made very significant investments in communications equipment and dispatching facilities in Manitoba. We've made very significant investments in additional paramedics, quite frankly, Mr. Speaker. 1,500 in the province of Manitoba, 290 when we came into office, an increase of over 500%, Mr. Speaker. We've got the STARS air helicopter system that's available since 2009 in Manitoba. And the fixed-wing service is an important service, and it needs to be in place. We have some of our own internal capacity for fixed-wing service for air ambulance, Mr. Speaker, including a couple of refurbished jets that are available in Manitoba. All of these resources are part of our total package of providing services to people, Mr. Speaker, and we will continue to find ways to improve services to Manitobans regardless of where they live in the province.
In fact, relatively few of the recommendations have been implemented, at best, very few. Mr. Speaker, the Premier is not fully aware of the extreme rural-urban divide that he and the Minister of Health have created within the paramedics' pay and working conditions. Rural paramedics have an average of 25% lower wages than those in the city of Winnipeg. The result of this large difference in pay scale is that there are 116 advanced care paramedics in Winnipeg and only 6 in rural Manitoba, as very few advanced care paramedics will work for the low and inequitable wages in rural areas. Why has the Premier allowed such a large rural-urban divide to happen on his watch?
Mr. Speaker, we've made dramatic improvements in paramedic service in rural Manitoba. When we first came into office, 80% of the service was done by volunteers. Many excellent people volunteered their time to do that. It has now gone the reverse, Mr. Speaker. The overwhelming amount of service is provided by full-time, professionally trained paramedics in Manitoba with modern equipment, modern ambulances, GPS technology, and a modern dispatch system that operates out of Brandon, Mr. Speaker. And they are supported by air helicopter service as well as air service, Mr. Speaker. So we will move forward on all these recommendations that have been put forward. We are moving on it right now. To answer the question for the member from Charleswood, we are making progress every single day. And I can only remind all the members opposite, including the member from River Heights, every time we put money on the table to make investments in technology, in equipment, and staffing, and budgets that will increase these services in Manitoba, the members opposite vote against it, Mr. Speaker.
Mr. Speaker, the rural-urban divide is not just about wages. Indeed, for paramedics working in rural Manitoba, the working conditions are often severe and have been labeled dangerous.
Yes.
With shifts sometimes lasting up to 36 hours or even days at a time without a rest.
Yep.
Under these stressful working conditions, it has been identified that 73% of paramedics are in need of psychological support, and 38% of paramedics are aware of a paramedic who has contemplated suicide. This says something horrible about the working conditions. And yet this Premier doesn't seem to care how severe it has got. When will the Premier act and provide fair and safe working conditions for paramedics in Manitoba?
Mr. Speaker, I appreciate the question from the member opposite. Because we do care about frontline service deliverers in Manitoba, last year we increased the number of rural paramedic positions by an additional 25 positions, Mr. Speaker, in Manitoba. We have announced the 16-seat advanced care paramedic program, Mr. Speaker, and we are going to make sure that we continue to provide supports and services and technology and all the necessary tools for them to be able to do a good job. And I only remind the member opposite and members of the opposition that we are bringing forward legislation in this session for post-traumatic stress disorder presumptive coverage, which means that frontline service workers will be able to get that coverage more rapidly because it will be assumed that it's a part of their employment that caused that post-traumatic stress disorder. That program will come forward in legislation, and it will have a strong prevention component to that as well, to make sure that people can avoid having to contract PTSD, Mr. Speaker, and get and have that symptoms upon them by having safe working conditions. We will have very significant improvements in legislation. I look forward to all the members opposite passing that as rapidly as possible when it's introduced in the legislature very soon, Mr. Speaker.